My name is Dr. Rodriguez. Did you know that chronic kidney disease, CKD, is a significant complication often associated with diabetes, leading to increased morbidity and mortality? Glucagon-like peptide 1, GLP-1, receptor agonists, such as semaglutide and tirzepatide, have emerged as promising therapeutic agents in managing CKD in diabetes patients due to their renal protective effects. These effects are mediated through multiple mechanisms, including improvements in glycemic control, reductions in blood pressure, anti-inflammatory actions, and direct effects on renal tissues. Semaglutide and its renal protective mechanism. Semaglutide is a GLP-1 receptor agonist that has demonstrated significant benefits in glycemic control and weight loss, both of which are crucial in managing diabetes and its complications, including CKD. The renal protective effects of semaglutide can be attributed to several key mechanisms. Improved glycemic control. Semaglutide enhances insulin secretion in response to meals and suppresses glucagon release, leading to better glycemic control. Chronic hyperglycemia is a major contributor to the progression of CKD. By lowering blood glucose levels, semaglutide reduces the glycation of proteins and the formation of advanced glycation end products, AGEs, which are harmful to kidney tissues. Blood pressure reduction. Hypertension is a common comorbidity in diabetes and a significant risk factor for CKD progression. Semaglutide has been shown to lower blood pressure, likely due to weight loss and direct vascular effects, thereby reducing the hemodynamic stress on the kidneys. Anti-inflammatory and antioxidative effects. Chronic inflammation and oxidative stress play a critical role in CKD progression. Semaglutide exerts anti-inflammatory effects by inhibiting pro-inflammatory cytokines and reducing oxidative stress markers, thus protecting renal cells from damage. Direct renal effects. GLP-1 receptors are expressed in the kidneys, particularly in the proximal tubules. Activation of these receptors by semaglutide improves renal blood flow, enhances natriuresis, sodium excretion, and reduces albuminuria, protein in urine, which are beneficial in preserving kidney function. Tirzepatide and its renal protective mechanisms. Tirzepatide is a novel dual glucose-dependent insulinotropic polypeptide, GIP, and GLP-1 receptor agonist that has shown superior efficacy in glycemic control and weight reduction compared to traditional GLP-1 agonists. Its renal protective mechanisms are similar to, yet distinct from, those of semaglutide. Enhanced glycemic control. Tirzepatide offers enhanced glycemic control by stimulating insulin secretion and inhibiting glucagon release, similar to GLP-1 agonists, but with additional benefits from GIP receptor activation. This dual action leads to better overall blood glucose management, which is crucial in preventing diabetic nephropathy. Significant weight loss. Obesity is a major risk factor for CKD. Tirzepatide has shown substantial weight loss effects, which contribute to reduced metabolic burden on the kidneys and improved renal outcomes. Blood pressure reduction. Similar to semaglutide, tirzepatide lowers blood pressure, which helps in mitigating the risk of CKD progression due to reduced vascular and glomerular stress. Anti-inflammatory and antioxidative actions. Tirzepatide exerts anti-inflammatory and antioxidative effects, reducing renal inflammation and oxidative damage. These properties help in preserving renal structure and function. Direct renal effects. The dual activation of GLP-1 and GIP receptors in the kidneys by tirzepatide leads to improved renal hemodynamics and reduced albuminuria. Additionally, tirzepatide's effects on lipid metabolism may further contribute to renal protection by reducing lipid accumulation in renal tissues. Clinical evidence supporting renal benefits. Numerous clinical trials have provided evidence supporting the renal protective effects of semaglutide and tirzepatide in diabetes patients. Semaglutide. The SUSTAIN and PIONEER trial programs have demonstrated that semaglutide significantly reduces the risk of new or worsening nephropathy. In these trials, semaglutide reduced albuminuria and slowed the decline in estimated glomerular filtration rate, eGFR, indicating preserved kidney function. Tirzepatide. The SURPASS trial program has shown that tirzepatide not only achieves superior glycemic control and weight loss, but also improves renal outcomes. Patients on tirzepatide exhibited reductions in albuminuria and a slower decline in eGFR compared to those on other diabetes therapies. Conclusion: semaglutide and tirzepatide, as GLP-1 receptor agonists provide significant renal protective effects in diabetes patients with CKD. Through mechanisms involving improved glycemic control, weight loss, blood pressure reduction, anti-inflammatory actions, and direct renal effects, these agents slow the progression of kidney disease. Schedule now.